Start.
Okay, madam. Thank you. Good afternoon and welcome to this webinar on Carbetocin in action. Case studies from the labor room is being sponsored by Hetero Healthcare. Hetero Healthcare, as you know, has got 25 years of excellence with 36 state-of-art manufacturing facilities. We have got 300 plus products in portfolio and presence in 126 plus countries. Hetero Healthcare has 21,000 employees globally, and we are amongst the largest manufacturers of ARV, APIs, and FDFs in the world. Hetero Healthcare is Asia's largest API manufacturing facility at Visakhapatnam, Andhra Pradesh.
Dominant क्या?
Hetero Healthcare is 360 degrees solution provider, striving to fulfill unmet healthcare needs, reaching to
अभी 2 मिनट क्या दिक्कत है?
reaching to customers across India with wide product range encompassing multiple specialties. Hetero Healthcare pioneers in quality and innovation and has distinction of bringing 4 biosimilar products to market within 5 years of initiation. Today's webinar, we all know that Carbetocin is used in the prophylaxis of PPH. And although we have got plenty of studies and documentation on use of Carbetocin in PPH and a lot of doc studies in PPH, we always like to have our own doctor's experience use of Carbetocin in PPH. For this, we have got Dr. Swati Mishra today as an expert speaker to give her inputs on her experience with Carbetocin. Welcome, madam. Dr. Swati
Thank you.
Mishra. Dr. Swati Mishra is senior consultant at Nilkant Hospital and NEX IVF. Madam is MBBS, DGO, RIMS, and DNB. Has been ex-resident at RIMS Ranchi and KHFH Patna. Specialized in laparoscopy, hysteroscopy, and sonology, infertility and high-risk pregnancy. Dr. Swati Mishra is trained in infertility IF and has been a winner in quiz at national level, endoscopy training at Pachi Hospital, Orissa, and has various prepared publications at both national and international conferences. Welcome, madam, and over the session to you.
Thank you, Dr. Prashant, and thank you, Hetero Healthcare, for giving me this opportunity. First, I would like to say something about PPH. PPH is the loss of at least 500 ml blood following vaginal delivery and 1000 ml following cesarean section. PPH is common and can occur even in women who are not at risk. PPH is the leading cause of maternal mortality throughout the world. Now, I would like to emphasize the etiology of postpartum hemorrhage, which is tone, that is, if uterine atony is not established, then it can lead to continuous bleeding, that is PPH. If the coagulopathy is present in patients, that is failure in clotting, then PPH can occur. And there is uterine injury, that is injury to birth canal or uterine rupture or uterine inversion or laceration that can lead to PPH. And if there is retained placenta or abnormal placentation like PPH, placenta previa, these can lead to postpartum hemorrhage. In such situation, the clinical findings will be abdominal tenderness, circulatory collapse, increasing abdominal girth, loss of uterine contractions, maternal tachycardia, and vaginal bleeding. These all cases can lead to uh, maternal shock. Now, if there will be tachycardia and there will be low BP, if the patient is pale and gush of blood coming out through the vagina, then PPH must be diagnosed and certain drugs should be given and managed accordingly to the cause. Now, what are the rationale for the development of? In such cases, we use different uterotonics, and carbetocin is one of the latest and most efficient and most compliant drug nowadays. Now, what are the rationale for the development of carbetocin in new with stable formulation? Carbetocin is available in a room temperature, stable formulation, and convenient vial presentation. It is stable at room temperature, has a half life of 24 months at 30 degrees and 75% humidity, avoids need of a cold chain storage and logistics, and is provided in a vial. So, as oxytocin is not at cannot be stored at room temperature, so it is very inconvenient for the low setup hospitals to maintain the cold chain. So carbetocin is a boon for such such cases. Now, use of uterotonic agents. There are different time at which uterotonic agents can be given. Time of administration can be at the crowning of baby's head, at the delivery of anterior shoulder, at the end of second stage of labor, following the delivery of placenta. In prophylactic use, prevention of PPH and active management of third stage of labor. And therapeutic use is management of PPH in all cases. Now, the molecules which can be used as a uterotonic are oxytocin, carbetocin, ergometrin, and symptometrin, that is ergometrin plus oxytocin, and misoprostol. Now, carbetocin, it is a next generation drug for PPH management. It prolongs half life and reduces enzymatic degradation. Drug is a synthetic long acting analog of oxytocin. Therapeutic indication is prevention of postpartum hemorrhage due to uterine atony. And its administration is one vial contains 100 microgram of carbetocin in 1 ml solution for IV injection, or it can be used even as IM. Now the carbetocin as a and its mechanism of action. Receptor binding triggers the activation of phospholipase C and the generation of the second messenger IP3 and diglycerol. IP3 induces release of free calcium from intracellular stores, and that leads to binding of calcium to calmodulin, stimulates uterine smooth muscle contractions by activation of myosin light chain kinase. So carbetocin acts as a smooth muscle contraction for smooth muscle contraction. Now there are carbetocin uh, as a non-inferior oxytocin WHO champion trial. There are different trials which are done in different parts of the world, and study design was non-inferiority double-blind randomized trial. Objective is to compare the effectiveness and safety of investigations heat stable carbetocin to oxytocin in the prevention of PPH after vaginal delivery. Patient enrolled about 30,000 across 10 countries, and primary outcome was proportion of women with blood loss at least 500 ml or the use of additional uterotonics. The proportion of women with blood loss of at least 1,000 ml in case of cesarean section. Now, the carbetocin non-inferior to oxytocin in all of the cases, and the frequency of blood loss of at least 500 ml or the use of additional uterotonic agents with carbetocin was proven to be non-inferior versus oxytocin. The use of additional uterotonics agent interventions to stop bleeding and adverse effects did not differ significantly between the two groups. So, the carbetocin was non-inferior to oxytocin for the prevention of blood loss of at least 500 ml or the use of additional uterotonic agents. Cochrane reviews says that carbetocin for preventing postpartum hemorrhage. In this study, from 11 studies involving 2635 women were included. Author concluded that for women who undergo a cesarean section, carbetocin resulted a statistically significant reduction in the need of therapeutic uterotonics compared to oxytocin. Also, carbetocin is associated with the less blood loss compared to the syncrometrin in the prevention of PPH for women who have vaginal deliveries and is associated with significantly low adverse effects. Now, guidelines recognize the benefit of carbetocin for preventing uterine atony. Who recommends carbetocin, oxytocin, misoprostol, ergometrin, and oxytocin and ergometrin fixed dose? But in Canada, carbetocin is used nowadays. Even in New Zealand, Pigo, Germany, and France recommends carbetocin for PPH management.
Thank you very
Now,
much, madam. Coming to your experience, madam. Uh,
In one case, there was a twin pregnancy in which I had used Syntocinon 10 units. Then PPH was not controlled. Then I went for this Carbetocin given, and the PPH was controlled within 10 minutes. So I was very
Yes. Assured.
um, uh,
Correct.
and
Correct.
there was one case IVF treated. My patient was IVF treated, and few bits of placenta was adhered to the posterior segment of the uterus. In
Irritant
that
placenta.
case, I retained placenta that to posterior. It was not previa. In upper segment, it was
Okay.
there. So I left some of the bits, did uterine bilateral uterine ligation, and give carbetocin.
Okay.
And after that, PPH was controlled
Very good.
absolutely.
Very good.
Yeah. And later on, also, there was no bleeding. So these are the cases when I used carbetocin and I was satisfied.
How long you have been using Carbetocin, madam?
About a year.
About a year. And
About a
what is the general use? I mean, IM, IV, or through infusion?
IV,
How
IV, IV,
IV
I
use?
use.
You
IV.
use a
Huh.
direct bolus, or you dilute it with 100 ml
I
or 50,
dilute with 10 ml.
10 ml, normal saline, and then
Direct I use give.
and
But there's no side effects,
there's no side
nothing.
effect. Correct, correct,
Uh,
correct. And what has been your overall experience with Carbetocin, efficacy wise and tolerability wise?
Efficacy wise and tolerability is good because in efficacy we don't have to see that it is refrigerated properly or not.
Absolutely,
In
that's important.
oxytocin we have to have. That is the main benefit
Main.
because sometimes the staff used to
Yeah,
keep
yeah,
their
yeah.
vials here there. They
Correct,
don't
correct.
maintain proper cold chain.
And
In that
talking
way, it is.
and talking about peripheries, maintaining cold chain in peripheries
In
is also
periphery,
difficult.
it's useful.
Correct.
If government supplies
Yeah,
in
yeah, yeah.
government hospital, then it's very useful
Correct.
because
And even in big cities, there is a lot of power outage these days. So maintaining cold
yeah,
chain may not
yeah,
be as easy
cold
at
chain is
within.
difficult
Yes,
in such a widely used drug.
correct.
Uh,
What is the patient profile where you can anticipate a PPH? Which patients can get
in case
PPH?
of in case of twin or triplet pregnancy, I'm IVF specialist, so
Okay.
I used to get twins and triplets. So in
Even
that
even
case,
triplets is common, no? Even triplets is common in IV with IVF.
triplet last month I had delivered a triplet. In that I gave, uh, but I don't prefer triplets. In case of
Obviously.
in
Yeah,
case
yeah.
of macrosomia, or in previous LSCs, placenta previa, or other cases that in IVF patients, sometimes I had done myomectomy previously, and in
Yeah, yeah.
those cases where there is scar, we can go for a carbetocin.
In short, anywhere
But
where you
in
can,
case of polyhydramnios,
correct.
fibroids, yeah,
In short, anywhere that you can expect a uterine atony, you would prefer to use this.
yeah, I prefer to use
Even
carbetocin.
uterine atony is common with fibroids and blood sugar, high blood sugar.
Chronic is not common, but we can assess more bleeding in case of fibroid. That's why I give attorney is
Correct.
not at all common in case of fibroid,
Okay.
but it can be given
It,
because of increased bleeding from other parts.
correct. When would you actually prefer a carbetocin or oxytocin for prevention of PPH?
In these cases, or if
Yes, high risk cases.
of high
Otherwise,
risk cases, and in case of where oxytocin fails, I give other drugs along with
carbetocin. So
carbetocin.
in short, a high risk patient will not like to take risk and you would straight away go for carbetocin other instead of oxytocin.
Yeah.
Yeah. You've just been saying that in case of retained placenta, you've just mentioned one case.
I have used.
Yes,
It was
yes,
again bits of placenta I had to
correct,
leave because otherwise it won't come out. So
correct,
I
correct.
gave carbetocin in that case.
Along with, of course, manual removal of
Yeah.
placenta. Yes,
Mhm.
it does help. And
It helped.
yes, what about RH negative mothers? Any experience you have got, madam?
I give only methergine is contraindicated, so I give carbetocin.
Carbetocin. Because in RH negative
And RH
mothers,
negative.
yeah, in RH negative mothers, PPH could be a major disaster, especially in the periphery.
Because
Getting blood,
negative
yes,
blood group
yes.
arrangement is
Exactly,
difficult.
exactly,
Uh,
exactly. Can a doctor use for carbetocin for prevention of PPH if oxytocin is used for induction? This would be normally be
yeah,
case.
it can be given.
In induction augmentation, oxytocin is commonly used.
I'm using it because in augmentation we use
Yeah, oxytocin.
oxytocin
Okay.
and in prevention of PPH, I use Carbetocin.
You have been using IV, you said, no, commonly. Is there
Commonly,
any place for IM route?
it can be given IM also, just like Syntocin, oxytocin.
But which
It
place,
can,
where you prefer the IM route over IV route?
in case of if I have to use it prophylactic, I can use IM.
IM.
Uh,
No specific
but
place
if
for
there
I.
is PPH and I have to use it therapeutically, I prefer IV.
Okay. If the patient is not responding adequately with carbetocin, which can happen, what additional uterotonics you can use?
I use Carbetocin even. Then I use prostrodine, misoprostol, methergine,
But
all
what is your
drugs.
next drug of preference after carbetocin?
My next drug of preference is Carbetocin, then methergine.
Methergine, okay.
Mhm.
Because
And
methergine is
misoprostol as well. After
as well.
uh,
And carboprost because of its side effects of asthma,
because of
etc.
its side effect, but sometimes I use. Very
Correct,
rare, but I
correct,
use.
correct.
Uh, even intramyometrium, I use prostrodine,
Carbetocin, yeah, prostaglandin.
Carbetocin.
What are the advantage of carbetocin or oxytocin, misoprostol, carboprost, methyl? Specifically, what I want to ask, madam, have you experienced a ADH-related side effect with oxytocin? Salt retention, water
Yeah,
retention?
I have seen patient.
Okay,
Yeah. In case of oxytocin, but carbetocin I'm using since last 1 year. I
nothing.
haven't
No.
seen, but it can. But let's see.
Very
It's not there till date.
good. And what is the advantage of carbetocin or misoprostol? Or I'll say side effects of misoprostol.
Misoprostol, there is a rise of temperature.
Fever, yeah, fever.
That
Correct.
is common in case of misoprostol. It is not common in case of carbetocin. And even if we give orally, matlab sublingually, there is chances of nausea and vomiting
No, say
more
no.
in case of misoprostol.
Which amongst them will act faster, madam? Misoprostol or carboprost?
I think carboprost.
Yeah, because the injection probably the route of administration.
Yeah.
And what are the side effects of carboprost that
It's
you have
mainly
experienced?
no vomiting
Yeah.
and
And a
even
contraindication in asthmatics. That's the major thing.
asthmatic. In case of asthmatic, we don't use. And even there is a passage of stool during
Carbetocin
delivery.
use. I mean, carboprost use.
Carboprost.
And methyl ergometin, of course, the rising blood pressure is a major side
A
effect in case.
major issue. And even in case of patient with liver diseases, where there
Okay,
is cholestasis, I avoid
methyl ergometin.
surgery. And
Methyl
in case
erg
of Rh negative patients,
okay. And methyl ergometin causes a complete contraction of uterus, both the upper and the lower segment,
our
unlike,
lowest. Yeah.
yes. Should carbetocin be kept as a reserve drug or should be used as a first line?
It can be used as a first line.
First
Its
line.
cost is only a
Yes.
problem
Yes.
uh, in using carbetocin. Otherwise, it's good mainly for storage purpose. We don't have to maintain cold chain, but the price is a problem
And
till date. Yeah.
yes, and
If
wherever
it is
where affordability is not an issue, I think it
where
should be used
there
earlier.
is affordability issues not there, we can use
Use for
carbetocin.
and carbetocin has a good advantage of it's a single dose. You don't require a cold chain. I mean, it can
That
be
is the
given
main, that
and
is
it
the main
can
advantage.
yes, it can be given in the peripheral centers where medical help,
Mm.
technical help may not be so easily available as
Yeah.
we require. And how do you compare adverse effect profile of carbetocin over oxytocin? I mean, you have mentioned most of the point, but any specific hemodynamic profile, especially clot or blood pressure or palpitations, any such side effect?
Antibiotic effects, I haven't seen in case of till date because I'm using it. I've already told you.
Yeah, yeah,
I'm
yeah.
using it since last 1 year and
1 year.
Synthocinol since last 15 years
It's a textbook
almost.
brand, madam. We have
So,
all used it. Yes,
so
we have
I
all
can't comment much, but I haven't seen any antidiuretic
yeah.
effects of
Carbetocin.
carbetocin till date. Yeah. In oxytocin, sometimes it's there.
It's there. And at last,
We have to use it cautiously.
your conclusion and your message to the team about carbetocin.
Carbetocin is a safe drug. It is effective. It can be stored at a room temperature. That is a main advantage. So it can be used in all cases of therapeutic as well as prophylactic PPH. But price is the main issue.
The price is the issue.
Uh, Main issue for
And,
patients who cannot afford
and
it.
madam, now that you use it IV, would a pre-filled syringe help? Yes, of course, for affordability, yeah, affordable patients.
Mhm. It
Prefilled
can
syringe,
help, but it can help
it can help.
on
I
one
mean,
hand.
it would reduce the time of withdrawal of this injection and then giving it. I mean, all those,
Yeah.
yeah.
It
Okay,
can be fast.
fast. And
Fast.
even seconds matter in PPH.
Yeah, of course.
Correct. Anyway, thank you so much, Madam, for sharing your
Thank you.
insights. Thank you very much. And
Thank you.
then,
Thank you.
yes, thank you. Before I sign off, let me wish you a happy and prosperous 2025. Thank you
Same
once
to you,
again.
Sam.
Thank
Same to
you.
you. Happy New Year to you and your
Thank you.
team.
Thank you so much.
Okay.
You can log off, madam. Thank you.
Okay. Thank you.
Thanks, Kapila.
Thanks, sir. Happy
And
New
wish
Year, sir.
yes. You also happy, prosperous New Year 2025. Thank you so much. I'm also signing out.
Okay, sir. Thank you.
Thank you.